Hello everyone, I am Dr. Aviral from Medica Superspecialty Hospital, Kolkata. I am a board certified consultant in critical care and internal medicine. So, a lot of people are asking, how do I know if I have COVID 19 and how do I make sure I do not have COVID 19? And unfortunately, there's no real clear way of doing so. COVID 19 is a viral illness, so it initially presents as any viral illness would do. It starts with a cough, most commonly in 80% of people, which then progresses to be a dry cough, and you start to first get what's called a low grade fever. This eventually becomes worse, where the cough does not get better and the fever starts to rise. This is what we would call mild symptoms. If a person starts to develop shortness of breath, that's another major feature that the patient's lungs are now starting to get involved. And this is when most people actually go to the doctor and unfortunately get diagnosed. Once your lungs are involved, one of two things could happen. The disease could stabilize and you might only need just rest at home and or in a ward, isolation ward of a hospital, and this is where 80% of cases will go. The remaining 20% of cases will continue to have progressive disease where their requirement of oxygen keeps increasing. In what we call moderate disease, they need to be admitted to a hospital and they need to be started on oxygen up to a maximum of maybe 6 liters per minute. This is moderate disease, and usually these patients get better within 5 to 7 days and can be discharged home. The last group of patients who get severe disease continue to have worsening lung symptoms and need to go into the ICU because they need more than 6 to 7 liters of oxygen every minute to keep the oxygen numbers in their blood stable. Some of them eventually land up going on the ventilator. This is where they have got significant lung damage and we need high pressure to get the oxygen into their blood. This requires 24-hour monitoring in the ICU along with 24-hour ventilator support. Recovery from this position is usually tougher and takes longer, and on average takes around 20 to 25 days to come out from the ICU, followed by approximately another 10 days stay in the ward of the hospital. Discharge from the hospital happens after we have sent 2 swabs from your nose or mouth and tested them for COVID 24 hours apart. And if they both are negative and the patient is asymptomatic, not requiring oxygen, not having fever for at least 48 hours, that's when we usually discharge them and send them home. I hope this was useful and informative to you. Thank you.